So hopefully everyone is expecting to attend the Russell-Cooke webinar on returning to the workplace. I know that we've had quite a lot of sign-ups, so it's great that everyone could join us today. This is the first in a series of webinars, little mini-series, I suppose, of webinars that we're doing for charities on coming out of lockdown. So there'll be a couple more in the series from other colleagues in my team. So look out for information that will be coming pretty shortly from our marketing team. This webinar is being recorded, and you can find the recorded version on the Russell-Cooke YouTube channel. So those of you who are signing in today, if you do want to watch it again or check anything again that we've talked about, you'll be able to access the recording. Equally, if your colleagues want to watch the recording or parts of it, it'll be available. And for those who are watching the recorded version, hello and thank you for joining. Just before we get going properly, those who are attending live, you can ask questions by typing in the Q&A function at the bottom of the screen, and equally you can also vote by pressing the little thumbs up button under someone else's question, so that rather than having 15 of the same question, we just have one that I know lots of people have the same question because you've all voted for it. And then there'll be a short time after the webinar, after I've stopped speaking, when we can have a look at some of those questions. As I say, if you're watching this as a pre-recorded webinar, you won't be able to ask questions as we go, but my details are at the end of the webinar, so you can get in touch with me by email or give me a call if you have any comments or feedback or you want any further advice. So today's webinar is all about returning to the workplace. Obviously, charities, as with so many other businesses, charities in a specific way have been very affected by the pandemic. And I'm very conscious that sadly there will be a lot of charities who have staff in certain teams, in certain roles, certain functions that actually won't be returning to the workplace. I'm not going to be talking today about doing restructures, about redundancies, about changes to terms and conditions, changing pay or pension, consultations, that sort of thing. But you won't be surprised perhaps to know that we are advising quite a few charities on these issues. So if these are things that you want advice on, get in touch. Today's focus is about coming back into the workplace. And again, even within this topic, I'm extremely conscious that there are going to be lots of different situations. Some charities perhaps never actually stopped working in the workplace with appropriate measures in place. If you're delivering frontline services like social care in parts of your charity, then you will have continued to work. Some of you might have already returned some staff, or all of them, or part of your workforce. Some may have staff on furlough or working from home, and you're just starting to think about returning to work. Some of you, you might effectively still be working as you did in full lockdown and haven't even begun to think about how you will go about bringing people back into the workplace and when you might do that. So, there's a lot of variation. I'm very conscious of that, depending on where you're at, and also depending on the type of workplace you work in and the type of workforce that you have. So, the difference between a very small office, for example, where there's just a few members of staff that live within walking distance or easy cycling distance of the office, can easily distance from one another. That's one set of facts which it's going to be a lot easier to deal with than a more complex situation where you've got people who are living in different geographical areas, who have perhaps different vulnerabilities, who are very anxious about returning to work, perhaps who are in BAME, or we will try to cover most of these issues today. As I say, the challenge for me is to do that for you in the next 30 minutes. And then afterwards we'll be able to take some questions. So here's what we're going to focus on in the next 30 minutes or so. Mainly what you as employers need to do to make your workplace safe to bring staff back. Now, remember though, if you're running a place of business or a charity that has visitors or deals directly face-to-face with beneficiaries, service users, clients, customers, then you're also going to need to think about how you're going to apply these measures to those visitors to the workplace, as well as to your staff. But the focus will be on bringing staff back to work today. The overriding message, which I'll come back to as we go through, is to take your time if you can. I think people will have quite unpredictable reactions to being asked to come back into the workplace. We all know how different people's reactions have been generally to the pandemic, to the measures the government have been put in place. Some people feel far more relaxed than others. Some people are very anxious, and it's not necessarily easy to predict how different people will react. I've heard stories already about people becoming very upset when charities have said, we'll continue to work from home until later this year, or perhaps move to a working from home model more permanently. The charity thinking that wouldn't be particularly controversial, and actually a number of their workforce, it turns out, are, suffering from loneliness, isolation, and actually find that the workplace is a really valuable place for them. So don't assume anything and take it slowly. We'll also have a look at some of the potential tricky issues, complaints, issues you might have from staff, concerns, how you the risks from a legal point of view, but also how you might deal with those in practice. So why are we talking about this today? Well, last month, it was the 17th of July, the government published this document, which I've highlighted in green here, the next chapter in our plan to rebuild the UK government's COVID-19 recovery strategy. Now, I should say at this point, after this, we will be sending the slides out to everyone who's attending. And along with the slides, we'll be sending out a document with all of the guidelines, documents, reference tools that I refer to today, and with links to each of those. So you don't need to be frantically trying to write down everything on the slides, or to find the link to these documents as I go through. They'll come out to you. I should also say at this point that I'll be focusing on the guidance that's been published for England. As I'm sure you know, the devolved administrations in Scotland, Northern Ireland and Wales have taken slightly different approaches. And so if you have staff working in those devolved jurisdictions, you will have to look at what the government guidance is in those areas. Today, as I say, I think we only have time realistically to focus on the situation in England, where I think the majority of people who are attending today will have their main workplace situated. So this government plan to rebuild, well, it's a kind of roadmap, as I've said, but to give you an idea of the timescale the government is thinking about, this roadmap goes up to spring 2021, with the idea that that's when we'll return to normality. Even then, though, that's heavily caveated with lots of warnings about potential changes to this roadmap if there's a resurgence of COVID. So the government wants people, wants staff, wants businesses to be ready, to be flexible, to respond to outbreaks. And obviously we've already seen local lockdowns in areas including Leicester and more recently the north of England. So I've put on the slide here that local authorities have already been given additional legal powers to do things like prohibit organisers of events from carrying out certain types of events, or to put requirements or restrictions on those events, or to prohibit access to public spaces, parks, etc. There's also an announcement from the government that there'll be further regulations coming that will give ministers additional powers, and those will be to do things like close businesses or venues within a local area or within a whole sector, to impose general restrictions on the freedom of movement of people, so local lockdowns, the kinds of things that we're already seeing some of, but we'll see that on a more local level. So in this context, when we're thinking about the steps that you're going to take to bring people back, your roadmap, your strategy for your charity has to try to build in some of that flexibility, has to recognise there may well be more disruption, and staff, their ability even just to come to work, to use public transport, to attend the workplace may change at relatively short notice. So it might well be that you need to think about your resilience, your ability to react to that very short notice, as well as how you might need to be flexible around policies that you normally apply to staff. So whether that's absence management policies in relation to COVID absences, or whether it's disciplinary action for lateness or something like this. Or basically, I suppose what I'm saying is what might be considered reasonable action for an employer to take under normal circumstances probably has to be reconsidered slightly in the face of COVID. That doesn't mean that you can't take any action against staff at all, but it does mean that you just have to think about whether you're satisfied that you can defend it as being reasonable in all the circumstances. So the purpose of really focusing on this issue today, being the start of August, is that from the 1st of August, the government have given employers more discretion around employees returning to the workplace. So up until the beginning of this month, the advice had been work from home if you can. Whereas now it's more of a move towards coming back to the workplace if it's safe to do so. So, there's no substitute for preparation with this. The next couple of slides will hopefully give you an indication of the steps that I think you will have to take in advance of even talking to your employees about a potential return to the office. The starting point for all of this is your health and safety duties as an employer. So those are statutory duties as well as common law duties made by the courts in case law. So in a nutshell, your duty is to, as far as reasonably practicable, and again we come back to this idea of reasonableness, of practicability, but as far as reasonably practicable, you have to ensure the health, safety and welfare at work of your staff. So there's lots of material out there. I'm sure a lot of you have seen an awful lot of guidelines, including from Russell-Cooke, really helpful stuff, but it can be quite overwhelming. So in terms of knowing where to start, knowing what the fundamental things you should be looking at are, I think that the guidance, the government guidance and the guidance from the NHS and the Health and Safety Executive that I'll be referring to today are absolute essentials that I think everyone should be aware of, every charity employer should be aware of. And then you may obviously build on that with sector-specific advice, with advice from particular organisations. However, always remember that guidance, even government guidance, is only guidance. It's not the law. It's not a substitute for your own assessment of the health and safety of your workplace. So even if you followed all of these things, if hand on heart your conclusion is that you can't currently make your workplace COVID safe, then just following these guidelines and ticking boxes is not going to be enough. The statutory duty is to keep your staff safe. So let's have a look at what these say. Well, the government's 5 steps to working safely. I've put the sort of headlines here. As I say, there'll be a link to this when we send out the document after this webinar. But the first step is to carry out a risk assessment. And the suggestion is that you follow Health and Safety Executive guidance on doing this. And then once you've carried out your risk assessment, you need to share that with your staff. You might have statutory duties to consult with trade union representatives if you recognise a trade union. You might have arrangements in the workplace where you have health and safety representatives from within the workforce, or you have a sort of standing committee of staff that you consult about things like this. Either way, you've got to consult with staff, and there are also some statutory duties, as I mentioned, to consult on health and safety. The specific requirements for that depend on whether you recognise a union or not. All of the information is in the Health and Safety Executive's guidance that I've referred to. The government guidance then suggests that you should share the results of that risk assessment with your workforce, and if you employ over 50 employees, you're expected to share the risk assessment on your website as well. That was slightly unexpected to me. Step 2, cleaning, hand washing, hygiene procedures. I think we are relatively familiar with these things, and the guidance refers to things like hand sanitizer, sinks, cleaning, disinfecting, encouraging people to follow NHS hand washing guidance. The third one, notwithstanding the fact that the message is return to the workplace if it's safe to do so, the guidance, the 5 steps to working safely, step number 3 is still help people to work from home. And this means taking all reasonable steps to ensure that if you are telling people to work from home, either some or all of the time, that you have things in place to help them do that. So that's technical things, that's like remote connections to your computer services, that's physical things like, do they have somewhere to sit, do they have a chair, those sorts of health and safety things that you're still under a duty to provide a safe workplace if you're telling people to work from home. And also physical, mental well-being while they are away. So the longer people are working from home, the more that the effect of being away from colleagues, of being away from managers, being away from their support circle could have an effect on people. So again, the guidance refers to taking steps to help people's well-being if they continue to work from home. The next 2 are in relation to social distancing. So step 4 is maintaining the 2-metre social distance. So that might include things like painting lines on the floors, having signs in the workplace for visitors, making sure workstations, desks are sufficiently far away from one another, avoiding things like hot desking where people are sharing desks, that sort of thing. Step 5, though, is essentially this sort of 1 metre plus thing, which is that, well, 2 metres is preferred, but if you can't manage 2 metres, then put in place measures to reduce the risk of transmission. So there's a poster that you can download, which is on the links that I'll refer to, which is staying COVID secure in 2020. You can put that up around the workplace. There are lots of other kind of posters and things that people have made as well that you can put in place to keep awareness up about these sorts of social distancing and hygiene measures in the workplace. There's also an online tool that I noticed the government have on their website, which you can use to help you carry out this risk assessment. So that's very worth doing. Again, provide the link to that. But very clearly, it is easy for me to sit here and say, here are the 5 steps you need to follow. I do recognise that for a lot of charities, in a lot of workplaces, just putting these measures in place is going to be challenging. It might require some quite substantial changes to the working environment or your working practices, and that might not be a quick thing to do. It's also just worth mentioning that obviously if putting these measures in place is going to cost the charity a lot of money, or is going to take a lot of time, resource from members of staff who would otherwise be getting on with running the charity and delivering frontline services, it might be also that your trustees need to just take the decision that taking these measures right now is in the best interest of the charity, taking everything into consideration, including the well-being of staff, the effectiveness of the workforce. But particularly if your charity isn't in great financial shape, the trustees may have to just record that they approved the spend that's necessary, the financial spend that's necessary in order to put these measures in place, and the reasons why they were happy that it was in the best interest of the charity. The Charity Commission has some guidance on their website, special guidance for charities during COVID. So there's some recommendations there in relation to financial good governance at this time. I have mentioned on this slide, just listed all of the sector-specific COVID secure guidelines. So you'll see these are guidelines that cover different types of workplaces. So when you're looking at the measures you need to put in place for an office or for a heritage location or working in people's homes, you should also look at the specific guidelines that the government have published for your sector. So once you have got to grips with these requirements yourself as a charity, and that you feel relatively confident that you're ready to go to staff and say, here's how we are going to make the workplace safe for you to return, here's how we propose you start coming back to work, This is when you need to communicate. You need to do this in advance. You need to give people the opportunity to ask questions, raise concerns, suggest alternatives as soon as possible. The view here with any consultation, as with any consultation, is to try to reach agreement with staff, to try to avoid things escalating into complaints or grievances or worse still claims, and also to keep the trust there, you know, because obviously your staff are incredibly valuable to you and you want to keep them working and being productive and being loyal and trusting you. So I have referred here to the statutory requirement to consult on health and safety at work issues, which I mentioned earlier. There's the health and safety guidance on that. I've also referred here to the ACAS guidance, which is more of a sort of guidance for managers, more practical steps that you can take, sort of advice essentially, which includes advice around consultation. So you're going to need to talk to people about things like, where do they live? How are they going to get to work? Are they going to need to use public transport? If so, what measures can they take to keep themselves safe while travelling to work? What measures might you be able to take to reduce any risks? Could you get them to start at a different time of the day when public transport isn't going to be so busy? Do they have childcare responsibilities? Have they been homeschooling during this? You know, what's going to happen in terms of putting in place those arrangements again? Do they have protected characteristics, by which we mean, are they protected under the Equality Act? So health conditions that might be disabilities under the Equality Act is the really obvious one. But equally, there might be other protected characteristics, pregnancy, maternity characteristic, for example, or even some religious or philosophical belief that relates to the handling of the pandemic that could potentially give rise to claims under the Equality Act. And that in order to avoid those, obviously early consultation, early discussion, really listening and trying to understand people's concerns. And then once you've discussed this, reflecting in your risk assessments, the actions you're going to take to manage those risks. When you're speaking to employees, you do need to acknowledge, as I said at the beginning, that they might be feeling very anxious. You should also be alert to the fact that lockdown may have had an impact on them that you don't understand or appreciate or know about. So whether that's feelings of loneliness and isolation, or whether it's a family member or someone close to them being ill, or even perhaps a bereavement. They might have been struggling financially. It might be that their partner or someone who they depend on has lost their job. Is there a fear of losing their job? You speaking to them about a return to the workplace isn't going to come in a vacuum, and you need to be as sensitive as possible to the fact that people are going through some very challenging times at the moment. Just looking briefly at some very specific groups of staff who you might need to think about more carefully, particularly from a legal risk perspective. So there's sort of, government have put people into kind of two categories, so to speak, the clinically extremely vulnerable and the clinically vulnerable. So clinically extremely vulnerable are those people who were told to shield, i.e. to stay in the house essentially from around March onwards. The shielding guidance ended effectively. Shielding ended on the 1st of August. So the secure guidelines for those people who were shielding now say that they are strongly advised not to work outside the home during the pandemic peak and only return to work when community infection rates are low. Now, for employers, what exactly does that mean? What is low enough? What community infection rates are low enough? You know, I think, you know, trade unions, ministers, individuals, pressure groups have been putting some pressure on the government to try and be a little bit more helpful in relation to these groups, because it's recognised that going to these people who are clinically, you know, very vulnerable to COVID and saying, right, well, now you have to return to work and you're no longer going to get sick pay, it is a very blunt instrument, and they may well be extremely anxious. Remember also what I said about government guidelines not being law. You still need to take into account all of your health and safety duties as an employer and the risks that come along with that. The legal risks related to that are that if an employee thinks they're at serious and imminent danger as a result of being asked to return to the workplace or being asked to work in a certain way, they have, they're protected under the Employment Rights Act. They can leave the workplace, they can stop doing their work. The case law in this area isn't particularly helpful to us. It's never really been used in a sort of pandemic type situation. It's much more commonly where, you know, there's a piece of equipment that isn't provided or something, and someone leaves until the equipment is there or the training's provided. These sorts of more subjective assessments of how much danger does there have to be in order for it to be serious and imminent, allowing the person to stay at home. These are probably all going to come out in cases that we will see coming into the courts and tribunals in the next year or two. But frankly, you as charities don't really want to be the test cases here. So I think in reality, if these people want to continue working from home, and if you can allow them to continue working from home, that's probably going to be the most straightforward, risk-free way. If they do want to return to work, you're going to have to think just a bit more carefully about what steps you can put in place to protect these particularly vulnerable people. It's also more likely that these people will be protected under the Equality Act, that the conditions that make them extremely clinically vulnerable will also make them disabled. So you have your duties not to discriminate and to put in place reasonable adjustments to help them to continue to work. The clinically vulnerable are those people aged 70 and over, or people under 70 with a specific underlying health condition. Someone who gets a flu jab each year, but who isn't on the shielding list, wasn't on the shielding list, and also includes pregnant women. So again, you know, many of you will be aware that there's specific requirements for doing health and safety risk assessments for pregnant women in the workplace, and COVID obviously needs to be taken into account when you do that risk assessment. There's also just clearly other people who may feel that they are vulnerable, may feel anxious. So that includes, you know, higher risk groups, increasingly evidence that the AME groups are more susceptible to COVID. So, you know, you need to be as flexible as you reasonably can. Keep records of information that you give to employees, keep records of these discussions, because if in the end you reach a point where you just can't get to a stage where you agree with the employee, then you may well need these records, unfortunately, in order to be able to defend a complaint against you or a claim against you. So, you know, just as I obviously encourage discussion, there does have to be some element of formality so that you have a record of what has been discussed, what was offered, the reasons why you couldn't put in place certain requests or you didn't think they were reasonable. So once you're back in the workplace, well, your health and safety duties don't just stop at you doing the risk assessment, you also have to implement the measures. And that means keeping awareness up. I referred earlier to putting up posters. You know, there could be internet bulletins, there could be memos, team meetings, anything where you can just make people continue to be aware of this. I think there's a real risk that there'll be fatigue after a short time back in the office. People will get back into their normal habits. They'll stop the distancing or stop being as strict about it. They'll stop wearing, you know, taking protective measures. So you really do need to take steps to keep that awareness up and keep people taking necessary precautions. You may take preemptive measures, so that includes encouraging people to maintain social distancing, but in relation to health, you could also ask them to voluntarily take their temperature before they come to work, stay away if they have a high temperature, or you could extend it to you as employers, taking your own preemptive measures to try and catch instances of COVID in the workplace. That could be temperature checks on employees, or trying to introduce restrictions on people while they're in the workplace. So for instance, asking people to stay indoors at lunchtime. There's a lot to consider here. There are, you know, human rights arguments, people's right to a private life. There are questions about how much you can really impose these things on people, and obviously ask them to voluntarily do it. There's also data protection issues. Again, it's not really for today's webinar, but I put a link in the guidance note I'm going to send to you to the ICO, the Information Commissioner's Office guidance on the data protection aspects of these sorts of measures. But I think one thing to really remember when you're talking to staff about this is that the health and safety laws in the workplace don't just place obligations and duties on the employer. They also place statutory duties on the employee as well, to take reasonable care for their own health and safety at work, and to take reasonable care for anyone who might be affected by their own acts or omissions in the workplace, and also to cooperate with their employer as far as necessary to enable compliance with any requirement relating to health and safety. So I think, with that in mind, it's worth really explaining to employees that this is a two-way thing. They are statutorily required to take steps to protect themselves and their colleagues. And, having done your risk assessment, communicated messages about the measures you're going to put in place, it may well be that you want to warn employees, either at the outset or if there is an instance of non-compliance, that failures to comply will be dealt with as a disciplinary issue, and that's how serious you take these. Obviously, you need to keep reminding staff to follow self-isolation rules, and they may change over time. We've seen changes quite regularly in the government self-isolation guidance, and also in relation to the NHS track and trace service. So again, keeping up employees' awareness, following that advice. The COVID secure guidelines, which I referred to above as well, also give advice on how to deal with a COVID outbreak in your workplace. And that includes having to get in touch with your Public Health England protection team, your local protection team, in certain circumstances. So again, thinking right back to making sure that your risk assessment doesn't just stop at the point where you come back to the workplace, but that it thinks about things that might happen once you are back in the workplace, including short notice lockdowns, but also potential outbreaks at work. The final thing to mention as well is that the Charity Commission guidance on their website includes updated guidance on serious incident reporting for charities during COVID. And one of the things that the Charity Commission, one of the examples they've given of the kinds of incidents that they do want to hear about is an outbreak of coronavirus in the workplace or suspected cases among staff, volunteers, trustees or beneficiaries, if that means that the charity is unable to continue to operate as normal, or that you're unable to deliver services that you deliver to vulnerable people. Okay. My concluding thoughts is really just a wrap up of the main messages that we've kind of covered in the webinar. As I say, as far as possible, prepare, don't rush, share your risk assessment, share your thinking, talk to staff, be as flexible as you reasonably can. There's obviously a limit, but do think about what's reasonable at these times. Keep lines of communication open, including when people come back to the office. Who do they go to if they've got a concern? Keep in touch with your home workers, particularly if vulnerable or clinically vulnerable people continue to work at home, but most other people have returned to the office. They might feel even more isolated than normal. Be ready to react to health-related risks and issues in the workplace, and plan to deal with short notice restrictions that could be imposed by local government or by ministers. Here are my contact details. As I said, if you're watching the pre-recorded version of this, then you can get in touch with me. If you are watching live and you forget to ask a question right now, you can get in touch after this webinar. I hope that's been helpful.